dear students, today we are going to see about the nerve injuries in the arm. That means when we have the humerus fracture, the different parts of the humerus fracture causes the injury to different nerves and different vessels. So this is one of the very important topic in the exam. This is very important topics for your FMG exam or your PG entrance exam. So that's what we are going to see today. Look at here, the first question we have here. The question says 25-year-old male presents with the injury seen in figure A. If injury is over here, and which of the following would be a contraindication to a close management with a functional brace? That means close reduction. Contraindication to close reduction. This is our question, right? So this is the mid shaft fracture of the humerus, right? So when we have the mid shaft fracture of the humerus, it can cause the radial nerve and the profunda brachi artery injury. Okay, so this can be another question. In the same question, they ask you about the management, but they can ask you about the injury as well. If they ask you about the injury, which of the following structures are injured, then we would choose the answer as radial nerve or profunda brachi artery, right? But they asked about the contraindication of the management. So during the contraindication, during the management, the close reduction of this fracture, what is the contraindication? They have given the option as radial nerve injury. This is not the contraindication for the close reduction. 1 centimeter shortening is also not the contraindication. 20-degree varus deformity is also not the contraindication. And comminuted fracture pattern, it is also not the contraindication. But the contraindication is the brachial plexus injury. That means if the patient has this fracture and along with this fracture, if he has the brachial plexus injury, then that is the contraindication for the close reduction, so that we have to go for the surgical intervention. So we know the answer of this question, right? So now let's go forward with the injuries. Look at here, the nerves. We have this is the median nerve passing over the the medial surface of the humerus over here in the lower end, you can see. And this is our ulnar nerve. Ulnar nerve is medial to the humerus and going posterior to the medial epicondyle here, right? So this is our what? This is the medial epicondyle, right? So this is how we have to see. And the another, in this picture we can see this is our radial nerve. Radial nerve is passing posterior to the humerus in the shaft. It lies posterior to the humerus in the shaft in the radial groove. So where it is in the radial groove. This is also the another question. And as it comes down in the lower part of the humerus, it comes anterior to the lateral epicondyle. So this is our what? Lateral epicondyle. Okay. So according to this relation, because if we know the relation, we will know the injury site. This picture, let's see over here. So in this picture we can see again, here we have one nerve, here one nerve, here one nerve, right? So posteriorly we have radial nerve passing. Anteriorly we have, this is my median nerve. Medially we have my ulnar nerve, and this ulnar nerve is going posterior to the medial epicondyle. Radial nerve is coming anterior to my lateral epicondyle, right? And here you can see the axillary nerve passing from the surgical neck, right? So what are the sites of the humeral fracture? One site is this one, another site of the fracture is this one, another site of the fracture is this one, another site of the fracture is this one, another maybe this one. Okay, so look at here, this is number 1, number 2, number 3, number 4, number 5. So if we have the number 1 fracture, that means this is the surgical neck fracture, right? And this is the shaft fracture or mid shaft fracture, and this is my supracondylar fracture, and this is my medial epicondylar fracture. This is my lateral epicondylar fracture. Look at here. If I have the surgical neck fracture, what is the injury here? Axillary nerve, right? So surgical neck fracture, axillary nerve injury. Mid shaft fracture, we have the radial nerve injury. If we have the medial epicondyle fracture, this is my ulnar nerve injury. Medial epicondyle fracture, ulnar nerve injury. If I have the lateral epicondyle fracture, I have the radial nerve injury. And if I have the supracondylar fracture, I have this nerve passing. This is my median nerve injury, right? So this is how we have to remember. And for this I can summarize with some formula over here. So let's see the formula of these injuries. In this formula we can see we can make a formula as ARM, arm, U, name, S-O-M-E, SOM. Okay, so arm U, because this is our arm, so we can say this is arm A-R, yes, and then M, and then we have U. Okay, so this is our A-R-M-U. This way we can see, and we have this formula. So let's see here. So let's start the fracture. So I have one fracture over here. This is my surgical neck. What is this one? Surgical neck fracture, right? So let's see, we have formula. Let's follow this formula over here. So A for, in this fracture, this is my axillary nerve, plus we have the circumflex humeral artery fracture, injury. In this circumflex humeral artery we have two, one posterior circumflex, one anterior circumflex. In the option, if they give you both, then you have to choose posterior circumflex, which is very close to the surgical neck. That's why in the surgical neck fracture, that is axillary, that is what? Axillary nerve fracture, right? Axillary nerve injury. In case of neck fracture, this is my neck, surgical neck N, right? So this is my surgical neck as N, A-N, axillary nerve in the neck fracture. Which neck? Surgical neck. So in the surgical neck fracture, I have axillary nerve injury. Along with axillary nerve, I have the circumflex humeral artery injury. The circumflex humeral arteries are two, anterior and posterior. Among this, posterior is most common. So if we have this injury, we will have the deltoid muscle paralysis, and we will have the teres minor muscle paralysis. If the deltoid muscle is paralyzed, then abduction to 15 to 90 degree is lost. If the teres minor is injured, then lateral rotation is lost. So this is the point we have to understand, right? So this is about the A and N. Let's go to the R. R means this point fracture. So this is my radial nerve, and radial nerve, if I go to the radial nerve, I'll go to the mid shaft fracture. This is my what? Mid shaft fracture, and sometimes it can injure in the axilla as well. That's why two places we can say, as it in the axilla or maybe in the mid shaft fracture, right? So that is AM. So if it is fractured, then radial nerve is injured. Along with the radial nerve, it also has the profunda brachi artery, posteriorly, right? So two structures are passing this way, and we have the circumflex humeral artery, axillary artery passing over here along with the circumflex humeral artery. Here we have the radial nerve and then the profunda brachi artery, right? So they are injured. If they are injured, then it produces what? It produces the wrist drop. Wrist drop means patient cannot extend, the wrist extension and finger extension is lost. Wrist extension is lost because radial nerve is supplying the extensor compartment. And next one we have the M, right? So this M means fracture over here. So this M means we have here M, and this M goes with this one and this one. That means what? I have outstretched fall that causes the supracondylar fracture. So it is causing which nerve injury? That is median nerve injury. Median nerve injury, what's the cause we said? The cause is that outstretched hand fall. This is the cause, and it is causing what? Supracondylar fracture, and it is causing median nerve injury. Along with the median nerve, it has the brachial artery medial to median nerve. This is also the question in the exam. What's the relation of the median nerve with the brachial artery? Answer is it is in the lower part of the humerus. Okay, so brachial artery is medial to median nerve. So two structures are injured over here, right? So what are those two structures? This and these two structures are injured over here. After this, if my median nerve is injured, so what is the problem it produces? If the median nerve is injured, it produces the M for M. Look at here, M for monkey. So it produces the monkey hand. Monkey hand means it's written as ape hand in the book. So ape hand deformity. Ape hand deformity means opposition of the thumb problem. Opposition of thumb problem. So opposition of the thumb means it is applying the opponent's policis in the thumb base, right? So that's why this is the problem. This is about the median nerve. And let's go to the U for, we have here ulnar nerve. So it is causing what? The medial epicondyle fracture. So look at here, we have ulnar nerve causing medial epicondyle fracture, ME. So we say this is what? The ulnar nerve, and it is due to what? Medial epicondyle fracture. And this is damaging my ulnar nerve along with the recurrent brachial artery. So if my ulnar nerve is damaged, it is paralyzing my intrinsic muscles of the hand. Intrinsic muscles of the hand. If they are paralyzed, then the patient produces what? Ulnar claw hand. It produces the ulnar claw hand. Ulnar claw hand means the presentation in case of what? The ulnar nerve injury. And one question they can ask you from here in the median nerve injury. Median nerve injury when we have the supracondylar fracture. Sometimes in the option they may not give you the median nerve. In the place of this median nerve, they will give you the anterior interosseous nerve. Remember, anterior interosseous nerve is the branch of the median nerve, and this is the most commonly injured nerve if we have the supracondylar fracture. So this is the very important question they can ask you in the exam. Now, two things remain we have here. That thing is that we have the lateral epicondyle fracture, right? So if the lateral epicondyle is fractured, lateral epicondyle fracture, it will injure the radial nerve. Again, same like fracture in the shaft. And now one nerve remain over there, that is my what? The musculocutaneous nerve. Musculocutaneous nerve passes from here. This region is called the deltopectoral region. What is this called? Deltopectoral region. So sometimes we have to approach our shoulder through this deltopectoral region. If we approach through the deltopectoral region, we may have injured the musculocutaneous nerve. So the musculocutaneous nerve is not injured within the arm. Musculocutaneous nerve is not injured within the arm. Musculocutaneous nerve is injured over the deltopectoral group. So during the deltopectoral approach, we will injure what? Musculocutaneous nerve. If the musculocutaneous nerve is injured, what's the presentation? There will be problem in elbow flexion, because elbow is flexed by what is this one? The musculocutaneous nerve, because musculocutaneous nerve supplies the muscles of the flexor compartment of the arm, right? So these are the injuries about the associated nerve and the vessels injuries in case of this, the humerus fracture. So remember that ARMU, that means the surgical neck fracture, axillary nerve is injured. If you have the shaft fracture, radial nerve is injured. If you have the supracondylar fracture, median nerve is injured. If we have the medial epicondyle fracture, ulnar nerve is injured. So remember like this, ARM, from above to below, right? And then these are the formulas as you can remember. So thank you very much. Thank you for watching, and please don't forget to subscribe.